Hi, I'm Dr. Neneman with Neneman Chiropractic Clinic, and thanks for joining us again in another week in our video blog series. One of the things I mentioned last week in our stretching video blog was I talked about tight hip flexors. A major problem with people is a high percentage of people work at a desk, at a computer, and so they're sitting all day. And when you're sitting like I am now for long periods of time, some people up to 8 hours, your hip flexors, which are the muscles in the front here that control flexion of the hip, which is basically, lifting of the leg. When you're in this type of position, these muscles shorten. They're in a shortened position when you're sitting, and when they're in a short position for, all day, every day, they actually can I say permanently shorten. I mean, you can get them stretched back out, but they'll stay in a shortened position. They tighten, and that's why last week I talked about stretching them. So that brings me to the video blog today. After last week's blog, I had a patient email me with a question, and his question was, well, you mentioned stretching the hip flexors. How do you stretch the hip flexors? So that's what the blog is going to be about today. I'm going to show you the best way to stretch your hip flexors. The two major muscles in the hip flexor region are the psoas muscle and the iliacus muscle. They're commonly together called the iliopsoas muscle, but they're muscles that run. The psoas actually attaches to the spine and then runs down, towards the hip joint. The iliacus it attaches inside the iliac crest here. It runs down through the hip region. Again, these muscles enable you to lift the leg. So I'm going to show you how to stretch them today. The best way to stretch them, keep them elongated so they don't shorten up and cause pelvic tilting or lower back problems. So what I'm going to show you here, there's basically, it's the same stretch, it's just two different ways to do it. But one of the easiest ways is to go down on a knee just like I am here. Again, we want to stretch, here's the hip flexor region. So with the front leg, what we're going to do is just kind of lean forward just a hair, and then you're going to tilt back just a little bit here, and you're going to feel the stretch right in this hip flexor region again. You just want to hold it nice and steady. Whenever you stretch, you want to hold it for at least 10 to 12 seconds to get the full stretch. But again, it's just a lean forward and a slight tilt back. You don't want to tilt back too far because then you're going to start compressing your facet joints in your spine. But this is going to give you a nice stretch, again, holding for 10 to 12 seconds. Now, the other way to do it, it's pretty much the same exact thing except in a standing position. So you're going to stand, again, with your leg out in front and with this leg slightly bent. And again, you're going to lean forward with this knee, not too far. You don't ever want your knee going out in front of your foot. It puts too much stress on your knee. You're going to lean forward with this leg, and you're going to lean slightly back here, and again you're going to feel this nice stretch in this hip flexor region here, again holding 10 to 12 seconds. So hopefully this shows you a good way to stretch. You can stretch daily, stretch both sides, hold the stretch 10 to 12 seconds. You do this day in and day out, you'll be able to slowly elongate those muscles again. And that could take a ton of pressure off your pelvis and lower back. You might start noticing you have a lot less pelvic and lower back issues just by doing that. So especially if you sit at a desk, you're at risk for shortening those muscles, so you need to be stretching them. So I'm really happy that the patient emailed me with that question. I was able to show you the stretch today. Join us back next week for another great topic. Have a great weekend.